So in Queensland, we have about 17 facilities, and that's excluding, I'm assuming most of our pharmacy intern students have potentially gone to the other breakout room. But that excludes our Ramsay retail pharmacy and also excludes any internal Ramsay Plus community services with allied health-based services that we offer. So if we work from the top of Queensland down, I'll go through some of the sites that have availability in graduate programs, both for the mid-year and the February program 2023. So starting up very north in Cairns, in tropical Cairns, we have 3 sites up there. They include the Cairns private hospital, the Cairns day surgery, and also the Cairns clinic, which is based on mental health services within that region. We come a little bit further south, we also have Hillcrest Rockhampton, which is quite a good facility there. They have medical, surgical, perioperative services, as well as mental health services there in Rocky. Then we seem to cluster down a little bit further in the Sunshine Coast region. In the Sunshine Coast, we have a co-located facility at Caboolture Private with the public next door. We have the Noosa Hospital, which services both public and private patients, but is run by Ramsay Healthcare. We have the Sunshine Coast University Private Hospital, which is a relatively new facility there and quite large, based at the heart of Sunshine Coast. We also have the Caboolture Clinic, which is mental health focused as well. Now, we know that mental health is a very big growing industry, and we really increasing services to ensure that we are meeting the market there and servicing patients that absolutely need us. So if we move down into more the Brisbane region, we have Northwest Private Hospital, which is very well known for its maternity services, but it's also got, your med surgical, perioperative areas, and a lot of general stay patients. We've also got New Farm Clinic, which is one of the biggest private mental health facilities within that region, with lots of mental health services. Out to the west, we have St Andrews Ipswich, and then we also have our biggest private healthcare hospital in Australia, which is Greenslopes Private Hospital, which has nearly every service that you could imagine, large graduate intakes, large employee base, service base, and opportunities there as well. So we all seem to meet at Greenslopes at some point in our career within Ramsay. It's where a lot of our IT hubs are. That's where Samrana is based for our HR team. So we have a lot of services coming out of there as well. As we head right down to the border, we have Pindara Private Hospital, which is in Benoa, but also has Southport Private Clinic, not too far away from it, which is another mental health facility. And it also has Short Street day surgery, doing day stay patient cases there. And then down to John Flynn Private Hospital, right on the border, servicing both New South Wales and Queensland patients in a variety of services. So in Queensland, our biggest hospitals would be Greenslopes, Pindara and John Flynn, but all those ones that I have mentioned definitely take graduates all throughout in a lot of different range of services and areas. So there's an opportunity there. We have educators that are based at all of those hospitals that focus on hospital education and training, and specifically fellowship candidates, graduates and interns, which is fantastic. And they have as well ward-based educators and clinical support teams ready to support all our new graduates. Currently, across Australia, we have, if we looked at both of our intakes, we're looking at getting close to 1,000 graduates, and the majority of these graduates are based in Queensland. So with it in those facilities, because we have such vast services and quite decent sized hospitals there. So that's kind of Queensland. That's where I'm based too, and cover all of those hospitals and the wonderful education and support teams there. I suppose the best thing for me to do now is to see if anyone's got any specific questions to Queensland, and I guess we'll come back to the main room. So if there's still HR questions for Sam as well, let's open to them along the way. The website that I'm currently on is the Ramsay Healthcare website. There's lots of great information in there globally. If you are looking more for career specific, you can actually go into this page or straight to ramsaycareers.com.au, which I might just sit my cursor on while we're sharing the screen. My internet will work as we're going along. There we go. So we will see that there is all of our graduate programs that will come up. Oh, I think I've taken me to the wrong page. In there. Eileen or Samrana, is there any questions while I'm typing this in?
Yes, do have some. We have some good ones, Liz, that you will definitely be able to answer. Are there any barriers or extra work needed for applying interstate, i.e. coming from Victoria to Queensland?
No, definitely not. There's no barriers there. And the best thing that we suggest that you do is request to have a placement within a Ramsay healthcare facility. So nationally, we have 72. We then, if you're say in Queensland and wanting to go to Victoria, but you could get the opportunity to go to St Andrew's Hospital in Ipswich to do a placement, you make the educator there aware that you're really interested in Ramsay, but you're interested in potentially going to Victoria. We have what we call a fast tracking program and a referral program that identifies high achievers or someone that we really need to know about might be wanting to move interstate. And then we have our great educator network that we can actually, help ensure that you have that transition or introduced into that state, and ways to highlight on your application that you are really interested in that state, even though you don't currently live there. So no, there's no barriers, but I always say that clinical placement's always a really good start, not only for us to see you, but for you to understand what kind of organisation we are and learn to love it and think, you know what, this is what where I want to work. Whilst facilities have different patient acuities, different bed numbers, etc. All of our hospitals are bound by the Ramsay vision and the Ramsay way and part of the Ramsay family. So you should feel the same kind of culture throughout.
Okay, Liz, so I've got quite a few questions about numbers. So people looking for specific numbers. Do you know how many Ipswich will be taking? Do you know how many Greenslopes will be taking? I'm assuming that would be mission impossible for you to answer with any degree of accuracy right now, or can you?
No, look, I can give absolute ballparks, and Samrana might have more specific details there as well on exactly how many they've got. But should we go through most of the hospitals, or there's specific ones being asked about, Eileen?
So I've got John Flynn, Greenslopes, Ipswich. Yep. Someone just wants to know how many grads do we take in each intake for Queensland?
Yep. So if we look at more specific hospitals, you'll find on average somewhere like John Flynn will take approximately 30 to 40 new grads along with Pindara each year. Now that could be a combination of registered nurses, midwives and enrolled nurses. What we try to do is not just churn and burn graduates. We employ graduates for our growth as well. So each year it's not going to be specifically this hospital takes this many graduates. It's never exactly the same. It's more about where the vacancies are and what growth we see our organisation having. And that's why we offer not fixed term contracts, they're permanent contracts. So we say if you're a graduate with us, that doesn't mean you're just doing a great graduate program with us. We're offering you straight up long-term employment. So, and that's with Ramsay Healthcare. So the numbers will change. Somewhere like Greenslopes can take anywhere, in my 10 years in this role, I've seen them take anywhere from 40 to 80 new graduates a year, and some intakes we've even got around 100 to 120. So there's a lot in there. Somewhere smaller like Ipswich, you would expect that they would take around 15 a year. Some intakes have that alone. So there's definitely opportunity. Our smaller sites in terms of graduate numbers will be the likes of like New Farm Clinic, Caloundra Clinic, Caboolture, that are very small sites, but you still see them take at least 3 to 4 grads, and some of them up to 6 to 8 grads each intake, depending on their needs. So they do range, but I always say don't be too jaded by numbers, because it doesn't, even if a hospital is only take 1 graduate, that doesn't mean that 1 graduate won't be you. And the way we do our application system is we do it in our regions. So you might say, look, I'm interested in going to Queensland and the Sunshine Coast, but Caboolture is my first preference, and Caboolture might only take 3. Now, you very well might be one of those 3, but if you're not successful in those 3, you're part of a region and a part of a bigger, wider organisation. So it doesn't limit you in any way. We have lots of vacancies for new graduates. Healthcare has expanded, and the dynamics of COVID and the impacts of that has really seen the change in our workforce. So we have a lot of positions available. So we want to take the best grads that we can. If you put your best foot forward, do your best clinical placement, then there is a really good chances that you will be that person that gets that position. And we take 2 intakes a year. So, and in between that. So whilst we say we take 2 intakes February and August, we have sites still continuing to pick up grads well and truly between those other months.
Liz, we have some people who are panelists, so they can talk. So
excellent.
Let's just go alphabetical, because I'm sorry, Philip promoted you guys, so I don't know at what point who got here first. But Athira, did you have a question that you wanted to ask?
Yeah, I was gonna ask, but someone replied for it. I was wondering, like, I'm a third year student, but I won't finish until November this year. So I was wondering if I'm able to apply for this position, or do I have to wait for the next one?
Yeah, so all the contracts that are offered, Athira, are based on subject to your registration. So if you're eligible to finish and complete your training at the end of this year, you'll be likely getting your registration at the end of this year, start of next year. So you'll need a 2023 program. So we encourage you to keep an eye on the Ramsay Careers website, which I have up on the screen now, which will have our timelines updated on them to see when the 2023 programs are. And from there apply. But I also encourage you, depending on what disciplines you're all in, and if you're close to a hospital, there could be other positions available to you during your training. So it might be assistant in nursing positions, it might be wardsman positions, it might be even volunteering in a hospital. So, there could be other positions that might be relevant to you, or you might be interested in before you actually gain your registration in your chosen long-term career path.
Yep, thank you.
You're welcome.
Can we go with Megan Theron next, please?
Hello, thanks for that. Amira, you actually asked my question and answered, so I have a follow on to another one.
Yes,
are you able to request an area specific and say, for example, if I only want to stay in Brisbane, can I only put those choices there? Because I don't want to have to move for my family. Is that a possibility?
Oh, absolutely, Megan. Yeah, what we do is we get you to write your first, second, and third preference down in your application. You can choose to say that's your first, second, and third preferences can actually be listed as Brisbane, and you won't be moved from within that region without being let known anywhere, or given further advice to say, you haven't progressed here. Do you want to be moved to a different region to be considered? So absolutely, you've got the ability to be able to do that. And the beauty of, if you're in Brisbane, you've got 4 or 5 facilities within Brisbane that are Ramsay as well. So if you're not successful at one of them, the whole region will look at your application too, if you're interested in that. You're welcome. Sam, did you want to add to any of that as well in returns of the application process? I think,
yeah, no, thanks, Liz. You've answered most of the questions. You responded to that one. So I think, yeah, pretty much what Liz has mentioned. Yeah, you can just put through your applications for all the preferences that you would like to, for all the sites that you would like to work for. And then, yeah, we'll be just shortlisted based on what which hospitals are taking in for which specialties. So.
Okay, I'm just going to say that we have a lot of questions, so bear with us and we'll try and get through to all of you. So we've got
mindful we're at 8 o'clock, so if people have written in the Q&A but need to go, we'll stay online for maybe another 5-10 minutes and try and answer, but we'll also take those questions down and put it in the recordings when we distribute it as well.
So we've got somebody called Vin Kanath that's been promoted to a panelist. Do you have a question?
Yes, thank you. So I'm an international student. I'm finishing my nursing degree this July, and I'm planning to write my English competency test by May 7th. So does it any way affect applying for this position right now?
You can, yeah, sorry, Sam, do you want to answer this one?
Yeah, sure, absolutely. Yeah. Thanks, Venkanath. So just keeping those application timelines in mind, it should not be a problem. You can definitely put through your, just apply for the tests, and tentatively, most of the sites will have the graduate program starting mid-August, but also really depends on the hospitals though. So you will have sufficient time to get your upper registration should tests go through, so that should not be a problem at all for the August intake. Lizzie, did you want to add something?
No, I was just going to say that your English language test will be a determinant on your registration. So
Yeah.
they kind of go hand in hand. And if you're gain registration and you've got the working rights in the country, we absolutely want you to apply. And yeah, don't hesitate to put your application in, and we'll help it progress as we see fit, or give you the information if it's not quite ready, pending those results on what to do next, whether you need to wait or what we need to do. So we'll support you along that way.
FTEs for the grad program, that's variable, isn't it, Liz? So the question is, what is the FTE of the grad program?
Yeah, so generally I think we're currently seeing about 90% of our graduate programs are around the 0.8 FTE, but working more hours. So we want to be able to give flexibility to our new graduates, and we found most requested to be more permanent part-time rather than full-time. So in the in the interview process, we ask what your preference would be, but we generally find most want to be around that 0.8, which means 4 shifts a fortnight, 4 shifts a week, or 8 shifts a fortnight. We do as minimal, some of our graduates on casual. We don't find that that's necessarily the best for your learning environment, but what we say is usually anywhere from 0.6, so that's 6 shifts a fortnight is the best learning, that and above. So that's where we generally offer up to full-time as well. So, but if you really want full-time, we will definitely be asking that in an interview, and we will support that the best way we can. As I said, we've got lots of positions available with the expansion of healthcare and the workforce needs. So there's definitely potential for any of that to be accommodated. I think maybe we've got time for maybe 2 or 3 more questions.
We got Leanne. Leanne has been promoted to a panelist there. Should be able to ask you a question. Can you hear us,
Excellent.
Leanne? You're on mute if you can.
Hi, how are you?
Good.
Good. Thank you.
I've just got a quick question. I've started my application for the enrolled nurse graduate program in Queensland.
Awesome.
Now, I've just not done my cover letter yet. That's because when I started doing the application, I thought the cover letter had to include like specific questions, but I can't find them in the application again.
Yeah, there's no specific selection criteria. We say so there's no specific selection criteria as such. It's you know, there's some points that we say we really would like to see in a Ramsay Healthcare graduate. They're probably good points for you to kind of say, this is how I think I can meet the, you know, the Ramsay vision, the Ramsay way, and be part of that family. But it's more, a cover letter is a quick introduction of you. We want it to be no more than a page long, because that's our first point of call. And, you know, we can get up to, depending on which intake, up to 1,000 applications. So your CV and your cover letter, we don't want them to be too long. Well, we know that most people have got the same kind of experience in the new role that you're coming into, which is none really at that point in time. So you're all kind of on the same playing field. So we just want to know how you're going to fit into our hospitals and why you really want to apply for us. And that's the main things we really want to see in that cover letter. Yeah.
All right then. Absolutely. So there wasn't any set questions?
There's not set questions to answer. No. But I would recommend that you kind of look at the advertisement and see what we're after, and see how you can just tell us how you fit that description.
All right then. Well, thanks so much.
You're welcome. Look forward to getting your application. Thanks for applying.
Thank you. Bye.
Somebody has asked where we will find the recording. So the recording will be sent out afterwards. Prospel will send that out to anybody that has been on this call today or that registered for this call.
Excellent. Yes, and you'll see that come through, and you can well and truly distribute that to any friends or colleagues that you've got studying with you that might not have been able to join tonight. We'll go for 2 more questions. Have we got any kind of trends in those?
Yeah, okay, so I think this is an interesting one. I'm interested in applying in Ipswich perioperative. I did not have any placement in theatre. Does that minimise my opportunity of having an offer to the programme? What are the shift times for theatres? Many thanks.
Yeah, so no, it doesn't limit your opportunity if they didn't have clinical placements in that area. You just need to express your interest in there. So clinical placement is good, but you won't get exposed to every area. So it doesn't mean that we won't be able to offer a position. Remember, graduate programs are all about learning along the way. So you may very well want to do a graduate program in an area that you've never experienced. So don't see that as a disadvantage. Shift times can very well vary. Some hospitals will do 10 or 12-hour shifts. Particularly in perioperative, you might have weekends and on calls, and depending on the size of the hospitals or the theatres that they've got will determine shift times, etc. Generally on a general based area, you'll have a morning, afternoon or a night shift. There's generally 3 shifts in most of our facilities.
Sorry, now I'm going to try and keep up with who's been promoted. So I've got Sunita Subedi, who's been promoted to a panelist. Are you still there, Sunita? Did you want to ask a question?
Hello. Just a quick question. So when I will be applying for registered nurse, a graduate program. So when we apply for graduate program, what do you look for? So
Oh, you've cut a little bit out there, Sunita, but I think
is outstanding. Yeah, what do you look for, like when you are reviewing the graduate application that makes the candidate outstanding from the other ones?
Yeah, that's a really tricky question because you're all, like I said, all on the same playing field in terms of experience in the new role that you're coming into. What can be a little bit advantageous, but not absolutely a deciding factor by any means, please don't feel that it is. Things like, have you done clinical placement with us? Because then we know that we can actually talk to some of your clinical facilitators and know specifically how you've been on placement. It could be, have you worked in healthcare before? And having good referees that have seen you within that environment are good there as well. Some of the other things that we might look at is in terms of where you have done your clinical exposure and if you know what you might be interested in, or whether you're looking for new opportunities, and also matching that up with what the hospital has available that you're interested in, and also the what you're after. So one of the biggest tips that I can let you know is can be something that's easily to say, you know what, that the person we shortlisted first is potentially applying and saying, I'm interested in this hospital, New Farm Clinic, and I want to be a midwife, and you haven't actually looked up to see that New Farm Clinic is actually a mental health facility and you'll never see a baby birth there. So just be aware of where you're applying for, get to know it, get to know the hospital. Feel free to always give the educators a call. We have contact lists and emails that you can contact if you want more information about that specific hospital, so you can go in confident knowing the facility that you're wanting to put your best foot forward in.
All right, thank you.
You're welcome.
Okay, I have one more question, Liz, and I think this is a good one. Sorry, there's loads more in the chat. Are there streamlined processes for development? For example, set pathways to move up into management or roles with higher responsibilities?
Yeah, that's a really great question. It's something that our organisation has been working on very well. We have so many different pathways, being such a big healthcare organisation, and we're actually formalising it down on paper. We have clinical coordinators and we have the Ramsay Training Institute, as well as hospital educators, and we look at different pathways, and also internal and external training that can get you there. And this is where the development is really going to come into play, the second part of your program. And we will be looking at you as individuals and saying, look, where do you see yourself? Where do you want to be? And if you say, look, I see myself being a CN or a manager of a ward, or I want to get into education, we're going to be able to advise you and go, well, this is the pathway we think you should take. This is what we can offer you within our organisation. Here are some partnerships we have external to our organisation that we can give you really good training through and help you develop that way. The biggest thing that we've got to remember about our company is we are taking grads not just to see them through a graduate program. We want to see you grow. We want to see you as a long-term employee and in positions that you love. So that will absolutely be an opportunity that we will discuss with you as an individual to find that pathway. But there is actual, on our Ramsay Training Institute, there's actual pathway documents of how we can go. It's almost like a pick a path. This is what I want to do next in my career. How do I get there?
I don't actually know the answer to the next question. Where do we find the contact list of educators in hospital facilities to gain more info, please?
So probably the best thing to do is go to the Ramsay Careers page, and Samrana's details are on there as well. So it might be just an email to Samrana. If we can put in the chat bar both Eileen and Samrana's main email addresses, and then we'll be able to direct you straight there. There is some links, but it's probably easiest to do that this evening.
So if you want to contact Samrana, who looks after grad recruitment, I'm putting her email address in the chat bar now, and then I'll put mine in. Don't want to spell it wrong now when I'm under pressure. Left out a vital E there. Is there a capped amount of hours or time limit that a registered EN can work if we apply for a grad program in 2023 but graduate in July 22?
No, we don't cap the number of hours. Well, we do at basically 76 or 80 hours as a full fortnight, depending. You know, sometimes some hospitals that are full time will do 76 hours and offer an ADO with those as well if they do the 80 hours. So that's generally what you do. No more than 5 days a week is what we recommend, and we're seeing with AHPRA and also our unions to see that that's a safe working environment, not to do too much more than that as well. All right, well, I think we're nearly 8:15, so we only really had this room until 8, so we've gone a little bit over, but it's fantastic because we've had so many really good questions and the interaction has been amazing. So I would really love to offer you the opportunity to utilise our email address and send any other questions you've got through. We'll take down a list of the questions that have been asked in the Q&A that we haven't actually addressed and send it through with our recording as well. We really hope that we have inspired you to work within our company and our organisation. We really would love to see an application come through. Please don't hesitate to contact us if you have questions relating to that process or our organisation. And I really appreciate your time in joining us tonight, along with my other panellists and still online are Samrana and Eileen. Really appreciate your time, ladies. Thank you.
Everyone.